Hello everyone, my name is Ervina Bilić. I'm a neurologist and it is a great pleasure for me to be with all of you in this virtual manner today. The nearest field of my everyday work are the neuromuscular diseases and clinical electromyography. In this short report, I would like to share with you some of our experiences, how networking in the field of neurodegenerative diseases, in this special case ALS, may have a great impact on everyday clinical practice. I would like to ask you not to take photograph of the slides containing materials with our patients. Neurodegenerative diseases are a spectrum and a network. They are a spectrum according to their pathophysiological shared background, according to their clinical presentation, and in some cases they may share some characteristics according to the treatment options. Neurodegenerative diseases also share many challenges for the scientists, clinicians, and caregivers involved, but before all, they are a big challenge for all the persons suffering from these diseases. Network is an obligatory pattern in any kind of approach to any neurodegenerative disease. NCALS is the biggest European network oriented to all the persons facing ALS, from patients, their families, caregivers, but also to all the medical professionals. It embraces many aspects of this very important neurodegenerative disease, from molecular pathways involved in ALS development to everyday clinical practice challenges, palliative care, end-of-life care, education, and support for the caregivers and all the medical professionals. Here you can see a small part of our Zagreb ankle center, and that we are very proud of. And now I will try to share with you some of our good experiences, why it is so important for us to be an orange dot on this European map, and to illustrate possible benefits of its valuable membership for our patients. Being a part of network may be a big step for small countries. In relatively small countries, there are only few or one reference center for ALS or any other neurodegenerative disorder. Networking, continuous learning, valuable opportunities for exchange, experience exchange, clinical consultations, scholarships, and focused teaching courses may significantly raise the overall quality of patient management in each country. Why is it so important for us? Having a network experience is an excellent predisposition for better coordination with non-neurological services and departments. We learned how to apply principles of international networking to our local or even intra-hospital networks. Being a part of something bigger presents an additional motivation for neurologists. It gives better perspectives for education and networking for young experts and students. We are also stronger in dealing with administrative challenges, obstacles, if we are part of international network. And in the end, very important thing to say, ALS registries are very important, especially today when we are witnessing new treatment possibilities based on specific or rare disease variants. Here is an example of the demographic data in our Zagreb ankle center, and those data were presented during the last ankles meeting last year in France. This year, meeting was planned for June in Edinburgh, but unfortunately it has been cancelled because of these epidemiological issues. ECAS is one excellent example how international networking may improve diagnostic and treatment of ALS patients. Here's a photograph taken 2 years ago when we have a meeting with Ivana Munitic from Rijeka University and Ratko Radakovic from Edinburgh University. We are very grateful to Ratko and his mentor Sharon Abrams for granting us permission to transfer this ALS-specific questionnaire into the Croatian language. Communication, education, sharing. It is almost impossible to define or to list all the benefits for healthcare professionals and disease people which may be induced or based on networking. Maybe communication, education, and experience sharing are the most valuable ones. Here you can see a few moments from our last meeting we have organized in Zagreb when we hosted in our center experts and our friends in the field of ALS. For this previously mentioned meeting, we published a book with all the texts and the educative materials. In this meeting, we participated more than 180 doctors from Croatia and all the neighboring countries. We have learned in our networking that even we are sometimes small, we are big enough for many small steps. We have also learned that sometimes several or many small steps may lead to a great and fulfilling achievements. What are the small things we have improved? The pulmonological evaluation is definitely one of very important steps in clinical management of ALS and other MND patients. It is important to invest time and effort in non-invasive ventilation masks, parameters, and before all, to give the patient time and space for the adjustments. We managed to establish the local network for home visits and controls for all ALS patients on a non-invasive ventilation. ALS is a devastating disease. It is a burden for patient, but also for all the people that surround him. Family support and care are valuable for the patient, but also for building the connections and relationships with medical staff. Here you can see one of our young patients suffering from ALS with her sister and a baby, and a moment of hairstyling in a hospital. Patients with ALS are the same persons they were before this devastating disease. They keep all the passions and interests they have before. We encourage every person suffering from ALS to do what they are loving to do. And this is the painting called Love Tree, painted by one of our patients. We just do not have in mind medical care. We also take care about other needs our patients may have. And here you can see one moment of manicure for our young patient suffering from ALS. Spiritual care is also supported for us and for our patients. Persons suffering from ALS are patients, but before all, they are persons with all the needs we all have. Spiritual care and support may be valuable for patients, but also for medical professionals, caregivers, and their family members. In the end, I want to thank to all of our patients, friends, their friends, our friends, all the colleagues from our local network, international network, for inspiring us and helping us to become what we are today. And we are very proud and very happy to do in the field of this specific neurodegenerative disease. Thank you for your attention.